So the title of our talk this afternoon, that's put on by the policy core of CHIPTS, is policy panel discussion, opportunities and challenges related to using technology-based interventions for HIV prevention and care. And we've heard tons of opportunities today, great opportunities, especially this morning, that we heard about things that can be used and possibilities for prevention and care that demand that use very, very sophisticated technological tools. So what we'd like to do today is to have a discussion among the four of us, the four panelists, and to talk about, where's Ramin? Ramin. Is he coming? Okay. I just lost track of the four panelists and me, and I'll moderate their discussion. But I'll start introducing them. On my immediate right here on your left is Tina Henderson, and Tina is the program manager for the HRSA-funded SPINS, which is a special project of national significance Women of Color initiative at the JWCH Institute here in Los Angeles. It's a demonstration site. This Linkage to Care research project is an integration of social and medical services for unstably housed and homeless HIV-positive women of color living on LA's Skid Row. To her immediate right is Ramin Bastani, CEO and founder of HULA. You've seen the lays around. I hate to wreck your gig, but that's where the lays are coming from. People are getting late. So HULA safely. HULA was formerly known as Cupid.me, and it makes getting information on STDs stuck less and helps people have more safe sex. He spoke in the National Library of Institute, Stanford, Health 2.0, and been grilled on the Mike Huckabee radio show. I don't know if we can be that tough today, but we'll try. To his right is Risa P. Flynn. Risa is the program manager for the clinical research program in the Health and Mental Health Services Department at the Los Angeles Gay and Lesbian Center, where she's focused on STI, HIV/AIDS prevention, intervention, and treatment research for the last 4 years, and has worked with many of the researchers here in the room from UCLA. And finally, Brad Sears is the executive director of the Williams Institute and assistant dean at the UCLA School of Law. He's published a number of research studies and articles primarily on discrimination against LGBT people in the workplace and HIV discrimination in healthcare. So I know the real news of the day is that, yes, Justin Bieber was arrested last night and has been charged with a DUI, and there are great pictures on the internet of his mugshots and everything, but we're going to try and be a little more serious than that today. So we have a little different format than anybody else. What we're going to do is each of the speakers will have, we have a certain order we're going to go in. Each of the speakers is going to have 3 to 5 minutes to talk about their particular interest in this subject in general, just for a general overview of it. The context is privacy and how privacy can be protected in the context of these new technologies. Each of them will talk about that. We'll have a 20-minute session where each of them will be able to question one another, discuss with one another about what they've said, and then we'll have 20 minutes left for Q&A from the audience. So our first speaker is going to be Ramin.
Hi, the name of the company is HULA, and the idea is that we help people make better health decisions before having sex by giving them the right information. So we do 4 main things. We help you figure out the best place to get tested. We help you get your records online. We all know how hard it is to actually get your medical records. We spend a lot of time figuring that out. We help you unzip safely and share your information with our little zipper feature on the app. And then we also remind you when it's time to get tested again. And we can go more in about stuff that HULA does, but some of the things are we partner with the LA Unified School District as a community partner, where we have posters in their classrooms and they talk about what we're doing. And we're partnering with different healthcare organizations to help get results directly to the patients. So we want to eradicate the idea of no news is good news. Now, regarding privacy, it's something we get asked about a lot. Everyone wants to keep their STD and HIV information secure, and that's what we've always been taught, correct? And that's the right thing. We think the shareability of the information is actually pretty important, being able to share it with a partner before you have sex and that conversation. Because a lot of times the conversation is, have you been tested? And it's like, yeah, I have. And then that's the end of the conversation, right? And this way you actually have verifiable information. But that information, you're worried about the privacy of it and how we actually protect that. We take all reasonable measures and go beyond those actually in a HIPAA compliant way to make sure the information is secure. And we can ask more questions about that as we get further along. We make sure that only you can access your own account, only you can request your own information, and I think that's all I want to say. Sure.
Pass that information to other people.
Right, you can share that information with someone else you want to hook up with, whether that be on an online dating site, and it's not like it says Ramin Bastani and then it has all my STD records. It's whatever my username is. Well, sometimes it does say that. But it'll say what your username is. So just think of it like an online dating site is how we think about security, is you have a username, and then you have your STD results. And then when you actually get in person, you can share your real name with them if you want. And we have that as a feature on our app. Does that kind of, I don't want to go too long.
Hello. I just like a lot of folks that said, I'm so pleased to be here today to really talk about this. I have to admit that I felt very antiquated sitting there, and it's like, I'm just not where folks are in terms of technology. But a little bit about the population, and I'm so happy that Nina just shared what she shared. So the group of, the population that I target are African American, Latina, HIV positive, homeless women. So these are women who are not in care, and our task, this HRSA Spins project, is to link them into care, or relink them into care. And so part of our initial task was, well, where do you find these women? These are women who don't necessarily want to be found, and probably would prefer not to be found. But we did. So we enrolled 141 HIV positive homeless women of color into our project. And many are very unstable, so not only house-wise, but there are a lot of mental health issues, substance abuse issues. And so the issue of, so when the grant was written, one of the things that was written into that was a website, a place where women could come and share their stories, talk about why they're not in care. And so I did a focus group. And in that focus group, it became very clear that not only did these women not want to be found, but they weren't going to use a website. They're not going to post their information on that website. And so I had to rethink what the reason behind us having a website, and that would just be for informational purposes only. So the idea of revealing their status was terrifying to many of the women, and still they do not, because the stigma is out there, right? So I'm not telling you anything that you don't already know. I'm sure there was something else I wanted to mention, but the issue of consenting, going online, how do you protect someone's identity if they may not have all the information or all the mental health stability to understand what they're consenting for?
Yeah, I'm Brad Sears. I'm a lawyer, and actually my background is in HIV and AIDS legal services law, and actually work a lot on privacy issues related to people with HIV in California. And so I'm just going to briefly make kind of 5 points where questions or concerns that this very fascinating topic kind of brings up for me. The first is kind of the level of legal protection that's implicated in whatever app or intervention that you're doing. So, with HIPAA, with the California Confidentiality Medical Information Act, with HIV-specific statutes, when you have health records, individual medical records, when you have records being taken by a licensed healthcare worker, your legal protection are at its height. The legislators in this and many states have really kind of thought through different scenarios. Once you step away from that, there's actually very little protection, legal protection for this information. So whether you're a public health record or an online dating site, it makes a lot of difference in the protections that individuals that are your clients would have with you, as if the state wanted to get the information, for example. The second thing I think about is a chance for accidental disclosures. They have happened in the history of the HIV and AIDS epidemic. Public health workers have left laptops and disks in an earlier day in parking lots and disclosed mass names. So it sounds like with your app you have protections, and I'm sure with your interventions you have protections. But with the aggregation of information, there's a chance for not just individual disclosures, but mass disclosures. The next two I'll just mention quickly, but they're a reality that's still out there, and so I think when you weigh shareability against the risks of having that information shared, it's important to remember that discrimination against people with HIV and AIDS is still very real, particularly in the healthcare setting, but at work, in social contexts. So part of the risk out there is not just loss of control over who is sharing that information, but the risk of discrimination. So for example, I guess like on your app, if you unzipped the person who gets to see that information, most likely there's no legal protection of that information once it gets in the hands of that person. They're not probably a licensed healthcare worker. You probably don't have a constitutional right to privacy like here in California vis-a-vis them because you've shared the information. They would have to do something like put the information up on Facebook or in a television interview to get at really the only kind of tort action that would protect privacy in that context. The other thing, and thinking, I think more outside of California than in, but is the issue of criminalization. And the majority of the states do criminalize exposure, not even transmission, by people with HIV through sex and other conduct. And in some of those states, the state has gone after online social networking sites for gay men to get information about whether somebody's positive or not. So where the key fact to getting you entangled with the criminal justice system is, are you positive? And there's an online record of that. That can get you in a messy criminal situation where every other fact is going to be a he said, he said, he said, she said, she said, she said, maybe. But the kind of key fact that gets you into the problem is going to be out there. And finally, I'll just end with this, which is something I've had to think a lot about in the work that I've done, both as a lawyer and doing research, is that I think in everything that we do in terms of interventions that we design, programs, services, there's an education function, and we should be educating people with HIV, people with other diseases, about how to treat their medical records, about how to approach their privacy. And just because the law allows us to do something doesn't necessarily mean we should do it, or as I often did as a lawyer, figure out clever ways to get my clients to share information with me and make it easier for me. What I want to be doing in my interactions with people with HIV and other conditions is setting a good model for them to think about how to approach the privacy of their medical information.
Thank you. So you stole just a little bit of my thunder, so I'm quickly recalibrating. First, I just want to thank you, Kevin, for inviting us to be part of this. It's a little intimidating after sitting and listening to these hours of science to represent the community and largely anecdotal information, but I think it's important that our voices be heard. I thought that Kevin was going to lead off with the Target example. So what, 1 million over, I don't know what the number is. 110 million. Target customers, potentially had their information hacked. The Pentagon has been hacked. The NSA is probably listening to us right now. And recently, as some of you may know, the LA Gay and Lesbian Center was the victim of a criminal cyber attack. We don't know what if any PHI was accessed, but we know that it's a possibility, and that has been a huge, expensive, scary event for us. So given that there are opportunities for nefarious access to records, and also now with ACA, with ACA legislation, patient-centered medical home legislation, it is in fact mandatory and incumbent on healthcare providers to make your healthcare information accessible. So we are having to provide that information, and the technology is, speeding ahead, and yet we know that nothing is unhackable. So people are sharing their information, they're wanting their information to be accessible, to be able to share it. I just went online for the first time and got access to my records through my HMO. There was a 10-page acknowledgement that I had to read, although one really didn't have to read it.
Just press agree.
I think, right? Just press agree. I did read it, and which went into great detail about who was going to have access to my information, and that I was acknowledging that, and I noticed at the bottom there was a little, tiny little note that said, check this box if you don't want to be reminded of this every time you log on, which gave me pause. So I think we are in a time where willingness to share data is growing, acceptability on the part of patients, clients, consumers to be involved in new technologies. I've been involved in a couple of pilots looking at fingerprint identification to facilitate retention and linkage and testing, use of vending machines to facilitate HIV test kit access, and there certainly is an interest, but I think that it's tempered, and respondents to surveys have expressed, it's tempered by real concerns about privacy and confidentiality. And last, I know I'm going long, all this has to happen, from a clinic perspective, all this has to happen in the real world. And in our clinic, where we are taking care of 3,500 HIV positive patients a year, and now at a primary care clinic, a transgender clinic, and a women's healthcare clinic, we have a very small IT staff and an even smaller, but brave and hardworking compliance staff. But where are if things continue to move in this direction, where are the resources at the community level to ensure that there are adequate protections?
Thank you all very much. So I think I'd first like to ask Tina and Risa in particular, what do you hear, and Risa, I don't know how much at liberty you are to talk about what happened at the Gay and Lesbian Center. I think not too much, right? But, okay, so now no. So we'll leave that off the table. But in general, what do you hear from your consumers about their concerns related to their privacy? You want to go first?
Well, I think going back to the comment that Nina mentioned that these women were reluctant to use the internet. I think, and I'm speaking I'm the voice of a very small, very specific population that's homeless, HIV positive women. So that's who I'm dealing with. And they're reluctant to go online because they don't want to be identified. And so you kind of have to understand the community in which they live. Downtown Skid Row, it is a support system, but it can also be a very violent, place. So you're walking along the street, and this happened to one of our volunteers. She was walking down the street, and someone came up and smacked her side to face. And so she said she put her key between her finger and said, "Come on, come on." And the guy walked away. So, but so you can imagine though, if you're positive and someone just out of the blue could come and knock you across the head, but whatever. So women tend to very much protect that part of their lives. You know, they don't want, we've had clients who refused to take a referral sheet that had anything about HIV on it because they didn't want it to fall and someone see it and they would be ousted in that community. So for me, speaking for them, they do not want to be identified, not in a public sense, but they appreciate the support. So it could be very vital for them. Right, right.
But they're willing to come, there's no aid sign over the door or anything, it's all very...
Yes, well, we have to be, so we do have support groups, and we had to be very creative in how we created those flyers for a support group where there's a screening process. So only the women who were part of the project were screened in. Anyone else who were, even if they were positive, we kind of referred them to some other place. So to keep their identity confidential.
So Risa, you deal with a much broader range of the community with that many clients. What's your take on this?
I think, you know, we have giant rainbow flags outside our building. So people that are coming into the building have, you know, accepted a sort of a certain amount of disclosure, although we do have a growing population, a non-LGBT population of consumers. I don't know, does anybody, like Matt, know the percentages of that population?
About 8%.
8%. So it's small but growing. And I think that so the perceptions and the needs of the population may start to change, but our job fundamentally is to protect healthcare information. And I mean that really drives all the policies and procedures that govern our operation. And I really can't speak to the incident and responses to it, but I think as a researcher, you know, the amount of time that we spend ensuring privacy and confidentiality reflects the concerns of the public in general.
And Ramin, you said that you follow all applicable guidelines, and you referenced HIPAA, and I wondered if what guidelines you're talking about specifically, if you're just talking about HIPAA, or if you have internal controls you put in place that double or triple or ultra protect that kind of stuff, or how you go about that and what that means to your clientele.
Yeah, we think a lot about HIPAA. We spent most of our time, we started the company in 2010 and spent an exorbitant amount of time with top HIPAA attorneys and other attorneys trying to figure out how to actually navigate HIPAA, because it's meant to, I mean, the P actually stands not for privacy, but portability. I think a lot of times people forget that of course you want to secure the information, as you said. That's what everyone wants with all of their information. But also, if the NSA can get hacked, anyone can get hacked, right? Everyone acknowledges those kinds of things. But for us, it's very much about a patient's right to their records. So the patient is requesting their records from this healthcare provider, and then the healthcare provider needs to send the records back to the patient. At that point, like you were saying, it's no longer under HIPAA, right? The patient has their records, the same as they would if they walk out with a medical record and then upload their results on a dating site, self-proclaiming I'm positive or negative or STD-free, right? Self-reporting. We bring the verified portion of that. So our CTO has 5-7 years experience working as a HIPAA-covered entity and developing a system that does STD records online. So he's the one who'd be best at answering that. But we comply in every way we have to with HIPAA and go above in a lot of ways that we have to. You're constantly playing this cat and mouse game of getting your system smarter than the people who are trying to hack it, right? There's certainly things HIPAA puts together. HIPAA is mainly about taking reasonable precautions and having policies in place to protect the information and being able to give it to people who want to access it, right? So, does that answer your question?
Yeah, but going back to your company for a second, isn't the HIV negative test result or an STI negative test result basically only as good as that day's information. Like that information could change the next day, and I don't know if it were me, if I'd accept somebody's telling me, oh no, I don't have syphilis, here's the proof from March of 2010.
Yeah, it's a question we get a lot, window periods, right? It's the most common question we get from a lot of people. And so exactly what you're saying encourages people to get tested more often because now they're accountable. It actually says on their record when they were tested. So if you see my records, it says Ramin was tested 5 months ago for these things, or my username would say that. And then you would make a decision whether or not that's okay with you as a person who's going to maybe potentially hook up with me, right? And that's what happens in online dating. We also have a little notice at the bottom of every single time your results are shared, and it basically says that a negative result does not guarantee this person is STD free, right? Play safe. We always advocate the use of condoms. We don't see this as a silver bullet in any way. This is a harm reduction tool as a part of the toolkit that we think creates more honest conversations based on actual health data, right? And that's what we're seeing people, I mean, there's 50 million people doing online dating. We heard all about them today in a lot of different forms. A lot of people self-report whether or not they've been tested, and they'll say HIV negative. Go on Craigslist. Go on Men Seeking Men on Craigslist and type in HIV neg or STD free. In LA, you'll get about 2,000 people posting those, right? So people are self-reporting a lot of information, and they're also posting that they're positive in some cases, right? And viral load count low or right undetectable. So does that answer?
Yep, it does. Do any of you have questions you'd like to ask one another, or?
I guess I'm just curious. You keep mentioning that you meet HIPAA standards. Is that because you legally have to, or you just see that as a set of standards that you should meet? Or is it, well, both of us have talked about is once the information gets to the patient, it might disclose to a dating site and something else is happening. So.
Could people hear the question? They were Risa, could you give them the mic?
So the question is, Herman keeps saying that he's meeting HIPAA standards. Is that because he legally has to, or he just sees those as kind of appropriate or necessary standards to meet, even though you're a dating site as opposed to a health record?
We're not a dating site in any way, to be clear. We are more of a personal health record where we're helping you get your information back. At this point, it's just STDs, but it'll be additional things as well. We want to empower people to have information, to actually have actionable information to make better decisions about their own health. But no, we don't have to comply with HIPAA at this point. We want to go beyond HIPAA. We want to go to where we think is the best way to secure the information as much as we can. And then we let our users decide whether or not they want to use this kind of service, because a lot of times the problem with STDs that we see is, and I've been tested maybe 50 plus times, and it's not because I'm getting so much action, right? It's actually because we want to understand what testing is like. And 95% of those times I hear, hey Ramin, thanks for getting tested today. If you don't hear from us in 2 weeks, no news is good news. But that doesn't always work, right? People fall through the cracks, they don't get notified, or they give wrong information for whatever reason it may be, and they never get their information. So we see it's pretty critical for people to actually get their information.
Yeah, and so I was looking at your app and some of the information online, and that was one concern I had, because you do use a lot of framing in terms of public health and health records, but then HIPAA doesn't, by the letter, you don't have to follow HIPAA. I assume you don't have to follow California's HIV-specific confidentiality statutes dealing with licensed healthcare providers or healthcare records. So when I go out and teach a community about what the rights to privacy are in California, I'll go through like the healthcare, the medical context, kind of a right to privacy that might be created by an organization like the Center, APLA, through a patient's bill of rights or through practices, and then everyone else where basically you have nothing. Or you have very little protection. And so I think it might be confusing unless, I don't know if you have a 10-page disclosure form or education form about what's going on. It might be confusing to people accessing the site, kind of what level of protection they have once the information gets on your site.
We spent a lot of time on our terms. We spent a lot of time on our terms of service, and if you read through that, it's incredibly clear what happens with your information. We make it crystal clear that we never use the word like we never say STD free. We never say the person is clean, because those are one. The opposite is dirty, right? The other one is also you can never definitively know that someone is STD free. But we spell things out in our terms of service, I'd say, better than anyone we've seen in the digital health arena, because we think a lot about the privacy of our patients. I'm completely private about my kind of information, right? And I would want the same for all of our users. It's in the DNA of our company to protect the information as much as we can. but to be incredibly transparent with our users about how it's all happening. So the terms of service is, I think, 13 pages.
I saw that you had something called a public profile. What is that, as opposed to for your information, that there's something that's kind of searchable as opposed to not? Or are you always picking people who get to disclose, or is there some more shared version?
I think what he's referring to is I, as someone on HULA, have the option to share my records with someone else. If I'm dating someone and I want to share with them my records, we're having that conversation, I can do that on a one-on-one basis. I think what you're referring to is if you want to have a more public link. So you can also, in the case of the 50 million people who do online dating, you can actually create a link for your profile where they can link back to your HULA record. Again, it's not your name, right? It's your username, kind of like a dating site, but it shows additional information about you.
And that link would show up somewhere else besides HULA? Like,
it won't show up on Google. It won't show up anywhere except where you actually put it.
That's a very interesting question. So let's say that, can someone forward that information? So let's say that they reviewed your file, you have a link on there. That's information they cannot forward, or can they?
If someone has a link, they can absolutely forward it to someone else. It's up to you with the profile to determine whether or not you can put your real picture on there, right, and what your username is. And what it has is just the verified information. The idea is to have sex, a lot of times you have to be in person. A lot of times I say. And in that case, you're going to want to, you have the ability through our app to share your real name if you want at one point. And I can revoke and unrevoke that access. It's much easier if you see the app, I promise. Our background is more in like Instagram, Facebook, technology. I mean, we see this just as a problem. We don't see it specifically as an STD problem, a health problem. It's just a problem, right? People want to have sex. It's never going to stop. We want to help them make better decisions before they do with more information that we think has been generally hidden or hard to get.
So, I would agree, and I don't think anybody would argue that you know, more information is better, and listening to the kinds of work that are, kinds of studies that are going on, it's potentially extremely, the technology is extremely valuable in terms of helping people to make safer decisions and stay healthy. But I think the comment that you made about no news is good news. You know, people get tested and then don't necessarily get a call back. We provide close to 20,000, I keep looking at my epidemiologist, I'm waiting for him to nod, close to 20,000 STD tests a year. We can't call all those people back and tell them that they're negative. So we are responding to that and moving towards technology to provide negative results. But I think that you also have to think about the positive results and what are the implications of people receiving positive test results in a you know, sort of isolated context without, you know, any kind of support. And we're having sort of related, we had some related issues around the HIV test kits in the vending machine, where there's been a lot of dialogue around, you know, the importance of people having access to testing, but what happens when, you know, a young person takes that kit into the bathroom, you know, by themselves and is positive. And even though there's an 800 number on the test kit, you know, what does that mean? So I guess I'm concerned in a similar way about that kind of information being available, you know, without any sort of professional support or counseling or social support.
I think that was a question for me, right?
Yes.
Okay. So we've heard the same concerns with healthcare providers. One of the potential solutions with one of the healthcare providers we're working with is to get all of their negative results out to their patients using technology. They choose what they want to do when it comes to an HIV positive result. They contact the person themselves and they have the messaging. But with one of the providers we're working with, if you're positive for chlamydia, gonorrhea, or syphilis, you still get the message and you get it directly through the lab. Meaning, they're not actually even putting it into a portal. They're getting it directly from the lab, and then then the messaging around that is, this is curable, right? Like, don't worry, don't freak out. The messaging they're choosing to put around this, and this is coming in the next quarter, and then they get linked back to services, right? That's the idea. Is a lot of people are slipping through the cracks from what we're seeing of our users, who come to us and say, wait, why am I positive for chlamydia all of a sudden? I was told no news is good news. I never heard back. And they get mad at us initially over email or over the phone, and then maybe they didn't give them the right information when they got tested. Maybe the healthcare provider doesn't put a priority on chlamydia, or it depends on where in the country it is, right? But that's why we think getting a negative result is also important. So we're helping providers actually do that, get the results out in a HIPAA compliant way to their patients, and then they get to decide how they want to deal with positives. And then have messaging and reminders, getting people back into care, being able to report that, just making the work that people do in this industry is incredibly hard. It's noble because the funding keeps getting cut, right? And they're doing more with less, and they're not using technology from what we see in a way that can actually help them kind of advance those things.
Can you share the population that you're serving, the age and gender breakdown?
I don't have it off the top of my head. We haven't actually looked at it that much. We don't ask for very much information at this point. We know later on that information will be really interesting. But at this point, we haven't really done it as much. We're noticing a lot of gay men who like the service, and we hear from them. We hear about people who are younger, high school students who really like the service because it helps them have what we call the modern version of "I'll show you mine if you show me yours," right, with their status. We've even heard we just got a couple of tweets from people in the porn industry who are starting to think about this as a way to verify their information. So it's kind of all over the place. And even some seniors have written into us.
Never mind, I'm just kidding. I read something today when I was catching up on Justin Bieber that that there are ways of digitally removing the condoms from the porno scenes, which I didn't realize, so that they could follow the law, our new law here in Los Angeles, but then digitally remove the condom from the scene. But just to switch for a moment before we move to the audience, last year the Assembly passed and the governor signed a bill that will allow internet disclosure of HIV test results. And while the language is a little bit fishy because it references anonymous testing, of which there is only now a very small fraction in California, it's mostly confidential testing and when in public sites, and when people are anonymously tested, if they test positive, they're asked to convert to confidential testing. So this would be internet information coming from a healthcare provider across the NSA observed lines and the hackable everythings. And how do you all feel about something like that? It's the law now in California. It's up January 1st. But what kinds of concerns does that raise for you? Do you want to?
Yeah, so I worked on the bill. By work means that I opposed it, and through that opposition got a number of amendments put into the bill, including that a secure code had to be set up for getting HIV test results. There are also some provisions that require a healthcare provider to talk to you in advance and confirm that you want to get the results over the internet, kind of verify that, and they're supposed to make of their own independent judgment that that's the best way for you to get the actual results of the test. None of that still doesn't mean that a positive test result couldn't be communicated over the internet, which I don't think is a great idea. I don't think that's the best way to receive the information. In another provision of that bill, for the first time we got some language in that medical providers actually do have to communicate something to those people who do test positive about what that test means. And it's a pretty soft requirement, but provide some linkages to care. And I guess, in working kind of on privacy issues, mainly in California around people with HIV for the last 15 years, there's been a constant push to greater sharing of information using technology, with getting more people tested, but without an equal kind of concern about what happens once the person gets a test result. So I was encouraged that this is the first time that actually there was a requirement of some information, counseling being given, and at least some sort of steps towards linkages to care for those who do test positive.
Because counseling in general has declined in the, certainly in the public sector since the funding for it was cut in 2009, and we all have had to make cuts, so.
Yeah, and part of our, if you're going to spend less time with the 20,000 people you're testing, most of whom are negative, let's spend a little more time with those who are positive.
Anybody
Yeah.
else want to
Well,
comment?
I admittedly don't know the details of the bill, I'm sorry.
That's all right.
But I would agree that, you know, we're trying to intervene at all stages along the continuum of HIV care. We're certainly, you know, trying to increase testing, but linkage is the most challenging. If you've all seen the cascade, and linkage and retention and adherence are the most challenging, and I don't know, again, this is anecdotal in my gut response, but providing that information, you know, through the ether, without really highly structured support is of concern.
Do you want to quickly, because I just got the word that we've got only 20 minutes left for Q&A from the audience, and I would like to save that if we can, unless either of you have anything pressing to say about that.
We like it.
Okay.
Overall, we like the idea that people have more access to their records.
Okay, so we would like to open it up to the floor. There are traveling mics around.
I just have a question for Ramin. I've used your app. I think it's a great idea as far as disseminating test results and people being able to share the results. But I have concerns about the process. If all it takes is your name, date of birth, and signature to request your results and the location, so it would prevent someone else from getting my results on their phone.
Thanks for using it, first of all. Second of all, really good question. We addressed that, and almost most of the questions you'll have will be in our FAQs as well. But specifically what happens is when you actually sign it, and then it goes to your provider with your signature on it, they're supposed to match that signature to what you actually signed in person. And if there's any discrepancy on that, they're going to call you. And that happens with a lot of our providers who, because sometimes it's hard to sign with a mouse, right? It kind of sucks. So they'll end up calling you and asking you if you're the one who requested the records, the phone number they have on record in that case. So that's one thing. And if people actually go as far to do that, and we haven't had a case of that yet, knock on wood, and we've been pretty good about, it's identity theft, right? Which is actually criminal if someone tries to go ahead and get someone else's records. But if they have all of that information.
Next question.
Hi, my name is Matt Beamer. I'm with the LA Gay and Lesbian Center. I have a question for Ramin. Ramin, sorry. You formed a partnership recently with Mr., correct?
Yes.
Where you can actually sign up for Mr., which for those of you who don't know is a geosocial networking app, and you can post your results online. Have you approached Grindr, Scruff, or any of the other geosocial networking companies? And if so, have they been resistant or have they been accepting of the idea? And can you give us a little bit of background of what the process with Mr. was?
We got introduced through Mr. And the partnership with Mr. Was that they wanted to do a campaign around HIV testing. So their idea was to promote to their hundreds of thousands of users to use HULA, because one of the best things we do is we help you figure out where to get tested in your area. We've curated our own database, so for them that was incredibly important, especially because we have an option to filter through LGBTQ. So they love that. They don't have any badge on their profiles on their site at this point. We've talked about that. Other dating sites have not been so excited about it. It just depends on which ones. You have Adam for Adam that already says positive, negative, don't know as an option when you sign up, but it's self-reporting, and we think things should move towards verified, especially if you're going to self-report information, because how do you know if that person's actually telling you the truth? Even if the results are from a few months ago, that's better than 20 years of sexual history versus maybe 3 months. So we've talked to different ones. We've talked to Match, the people at the highest levels of Match.com. The straight sites generally want to stay away from, the ones that are predominantly straight, want to stay away from the idea of STDs because it ruins their business model, getting people to sign up. But we've had other apps approach us as well. Mr. just happened because we didn't have to do a direct integration with them, and it was just a promotional thing at this point. But we'll be doing more of those. We see it in the future where you can actually have a badge if you want that actually shows that you have been tested recently. And then you can share the information however you so choose at a later time. And especially sites like swinger sites have reached out to us, and sex workers as well, and different sites like that, where this helps them with their clients, perhaps.
Yes.
Hi, I'm Stein Dominguez from East Los Angeles Women's Center, and I just have a curiosity question for the gentleman here in the corner. As far as disclosure for an HIV positive person who has a spouse or gets into an ongoing relationship with a partner, what is their legal right to disclose their status to that person?
What's their legal obligation, or?
Well, I know that ethically the right thing to do, right? But I'm talking about legally because I hear a lot of conflict about this. That if you're HIV positive, that you don't have to disclose your status to even your spouse, as long as you protect them with the option of using protection, and then it's up to them whether they want to use it or not.
Yeah.
Can you clarify that?
Yeah, so there's so the law intervenes in two ways. One is crime, so something that you can end up in jail for. The other is you end up in court and getting sued for damages or money. So on the crime side, if you know that you're HIV positive, you don't use a condom, and you don't disclose, and you have the specific, and you have anal or vaginal sex, so if you have other types of sex, that doesn't matter for the crime. And you have the specific intent to infect the other person, that's a felony punishable up to 8 years in California. Either disclosing or use a condom means you couldn't be punished under the criminal law. So very few people have actually been prosecuted under California's criminal law.
He says, she says.
Yeah, and the specific intent part has to be beyond the fact that they know that you're positive. This is unlike most states in the United States with these type of laws, where the fact that you know that you're positive and you have sex is enough to basically meet the elements of the crime. On the civil side, so could you be hauled into court and be sued? The standard is actually much looser, and there's even a California Supreme Court case about a couple who got married. They both allege that that the other one infected them, but what went forward is basically that people, and this applies to people who are in a married relationship, have an obligation not only to share their HIV status or their other diseases, but any sort of sexual history that might lead the other person to believe that they would have an STD. So it's a much broader standard. The court went out lengths to say it wasn't talking about one-night stands or other little types of relationships, but that in a married relationship you have an expectation. Because before you get married, everyone shares their whole sexual history. So at least the California Supreme Court thinks that's a great moment for couples to disclose everything about their sexual history.
Other questions? Yes. Go ahead, sorry.
In California and throughout the United States, this is a heaven or hell moment. I think we can use the technology to really educate and change lives. And now that we know that the NSA is really watching us, and this is 1984, it can really harm people. Again, it's like anything else we sign up, whether it's Facebook or whatever, information that we give people access to can go wherever it goes. So I think this is a great opportunity to not only educate the providers and the researchers in this room, but to educate the public. I was just in Georgia. They had a man on trial who was on Black People Meet, which is a dating site. And he was married when he got infected, and then he had an affair while he was on Black People Meet and infected a married woman. He's going to jail now. Again, this is not California, but again, this is a time for us to pause and think about our future and where we want it to go and how much control we want to let other people have access to. So I don't know. I spoke to Ramin and I got laid. It's over there, it's over now. But the bottom line is...
Did you check his record first?
We had safer sex. But the bottom line is, again, this becomes an opportunity to change some of the health disparities that are going on in communities of color, where people are not telling people that they're HIV positive or they have an STD. So again, it becomes an opportunity if we choose to make it that way. And I just wanted to say that and to thank you all as a panelist.
Where's the mic going? Over here?
Hi, Kurt Cabrera-Miller with Northeast Valley Health Corp. With Roman, just a quick question. How does HULA get their list of STD test sites and doctors? I'm looking at your website, and I see that Northeast Valley's juvenile centers are there, but not our HIV clinic. So I'm trying to figure out why that is.
Yeah, we started off with the problem with the database. Sorry. The problem we saw was, the reason I started the company is some girl slapped me in the face and asked her if she was tested, right? That's how the company actually came about. Then we soon discovered it's a much bigger problem, obviously. I did. And then one of the problems was people actually don't know where to get tested. And we were using the CDC database initially, but the problem was you have duplicates and triplicates, right? And the information's not updated that often. So we went out and created our own database. So for the last couple of years, we've been curating a database of the best places to go in certain areas. We've done a deep dive in some areas and not in others. We cover a couple thousand clinics across the country that we've either called and verified the information, so we have accurate information on hours, what they test for, what populations they're for, or if we can count on their website and we think that information's good, we'll go there. And we're adding probably 100 new ones a week. So if your location's not in there, please send us a note and it'll be on there probably within 24 hours. We'll verify the information. It's not just anyone sends us information, all of a sudden we'll just put it on there. But we'll call them to make sure we'll get their information from them. In the future, what we're doing to solve the exact problem you're talking about is we're not able to, just as the CDC wasn't able to, keep all this information in one place and consistent. So we're crowdsourcing the information with the healthcare providers who will be able to actually take control of their profiles in our locator, and they can change their hours of operations as whatever happens. They can show promotions, they can have their forms on their videos and stuff like that. So we'll be rolling that out in the next couple of months. And sorry we missed your site.
No, it's fine.
Hi, my name is Keith Herman Stein. I'm a Robert Wood Johnson Foundation Clinical Scholar at UCLA, and I have two questions for the panel. The first one is in regards to the implementation of the Affordable Care Act. What is the panel's thoughts about potential opportunities for investment in healthcare related technology via texting or other forms of media, or and if there are potential benefits and potential challenges related to the Affordable Care Act? And then my second question is in terms of, for Ramin, in terms of your app, is there a way, or is there any interest in letting people talk about ways that they might be using biomedical prevention, like if they're using PrEP in ways that reduce their HIV transmission risk?
Who wants to start on the first part of the question?
So I would like to say that one of the things I'd like to see, in case you hadn't noticed, most of the information was around YMSNs and very little about the use of technology among women, being HIV positive, disclosure, etc. So I would love to see more happening around that. So Nina presented a piece of the study that she's already doing, the intervention. But there's very little out there on looking at the use of technology among women and how it can benefit remaining in care or using or taking the medication.
Okay, so I'm not an ACA scholar, and I didn't read all 1,300 pages. As I think I mentioned before, there certainly is, part of the foundation of the law is improving access to information through meaningful use, mandating sharing of information. I don't know how detailed that is. I know what the burden is on our clinic in terms of being able to meet those standards, and they're considerable. But I don't know more than that.
Yeah, I don't know much more than that either. Look, I think there's a lot of great potential there. I think patients having access to the medical records is kind of in real time, and there's a lot of great potential, and that makes a lot of sense. Not having to be a huge hassle for your different healthcare providers to share records. There's a lot of potential there, and that there's a lot of risk. Not only was the initial act long, I think a lot of, California probably did as well as any state of trying to anticipate what was going to come this year and start moving a couple of years ago. It started thinking through some of the medical information sharing and the privacy concerns a couple of years ago. I don't think most states have had that time or thought put into it, so I think there's a lot of risk there as well.
To your question about PrEP, it was, do we show that information? You mean, we will at some point soon. That's the idea, right? As we get that information, if we can find databases that have that information on a national scale especially, we just want to help people make better health decisions, right? So part of that problem we see is people not knowing where to get tested, right? Actually not knowing what's the right place for them. I've been in places where I've been rejected because I'm straight, because the funding doesn't come for me, right? I've been in places that are for women, they suggest I get tested elsewhere. So I have plenty of experiences, I understand that, but we want to include whatever information helps our users, our customers, make the best decisions on where to go.
Time for one more question.
My question is about 3 or 4 years ago, I know that there's at least one team, I think there's maybe 2 teams, working on a device for your smartphone so that you can use probably urine or blood or something, and it automatically tells you what's STDs and whether you have HIV or not. And I think that it's still in the works, obviously, but one of the big challenges, as I understood it, were some of the ethical issues. And I'm wondering, what might be the special challenges of something like that beyond just your standard HIV test at this point? That might be, a portable test. I mean, is there something that would be different about that would make that particularly challenging?
Except for the lawyer. It sounds lawyerly.
I'm not sure I quite understand the question. Your question is there anything particularly challenging about that in terms of privacy, or?
Yeah, if that device comes out, if it's not a technical issue, on the legal side, is there something special about the fact that you have like an app on your phone, so you could automatically do testing like every day if you felt like it, because there wouldn't be any cost or whatever. So if you did this with a partner or you did it with yourself, what are the special issues that would be beyond just having an HIV test kit in terms of privacy?
I think the test kit raises a lot of issues, kind of interesting issues. So but I don't know, I can't think offhand of what the difference would be. I mean, so the at-home test kit, poses the risk of, you're testing yourself or somebody else is, getting some of your saliva or something, or getting enough tissue to test you and then being able to share that information. So one reason all the laws that we currently have around kind of HIV privacy deal with healthcare providers is those were the people who had the ability to do the tests. Once that changes, or that has changed, I think the law has really caught up with that. And to some extent, we don't really have a robust sense of privacy with one another. It's very kind of in these special categories that I've mentioned before. So as a legal services attorney, most of the people who called me were somebody in my church, told other people that I was HIV positive, or my family member, or somebody walked into the clinic when I walked into the clinic that was from my neighborhood, and they went and told people. And there's really nothing, the law hasn't created a response to that. So it will be interesting to see that with all this information sharing, kind of increased ability to test on our own outside of kind of a healthcare setting, whether the law will catch up and provide some protection.
Yeah, the only thing that I would say is that, again, with respect to the HIV test kit and whatever further evolution there is around that, there's no question that the more people who know they're positive, the better. But how people receive that information, in my opinion, really needs to be part of the calculation. We approached, in starting to use the home test kit, we approached the center's homeless youth center, and they said no, they wouldn't put the vending machine inside the youth center because the risk of, you know, this highly vulnerable population receiving their results, you know, not in a clinical setting and without a caseworker there and a counselor there, they just felt was too great. So
And there's no charge for the tests.
correct. It
wasn't, we didn't have to put money in.
Correct. So I just think the two things have to be held together.
It's coming. Our medical advisor, Dr. Klausner, sent me an email that's completely Theranos, and it's coming with 1 drop of blood, right? In the UK, they're working on it as well. I mean, it'll be here, so there'll be definitely challenges around it, but it'll be here, and it's real-time information about your health status.
Okay, I'd like to thank our panelists, Brad, Risa, Ramin, thank you all for your time. You solved the problem.